Doctor, please, can you review the antibiotics for Mr. Akelo?
Why? What is the problem?
He has been on intravenous antibiotics since his surgery 3 days ago.
Yes, we use antibiotics post-operative to prevent infection.
Yes, doctor, I understand. But I thought that for most procedures, the recommendation from the World Health Organization is to just use single-dose prophylaxis now. His wound is looking clean. He is showing no signs of infection. I'm worried that if we continue antibiotics when they aren't needed, he may develop adverse effects. We had a patient last week who had terrible diarrhea as an adverse effect of his antibiotics. It really impaired his recovery.
Okay, Ness, thank you. I'll go and review him. I agree with you, Ness. Mr. Akelo looks very well and his wound is clean. I have stopped the antibiotics. I really think we need to speak to our colleagues about the length of time we use antibiotics on our post-operative patients. The evidence and antibiotics prophylaxis guidelines support single-dose prophylaxis for most procedures now.
Overusing antibiotics can have serious consequences for our patient and for our future patients. We need to rationalize our use of antibiotics so that we prevent antibiotics resistance occurring.
I'm glad to see the antibiotics have been stopped. As we know, this reduces unnecessary nursing time, expense, gets patients out of hospital quicker, and less risk of a line infection from the IV site.
We must ensure that the World Health Organization surgical safety checklist is being used before all surgical procedures. This reduces the risk of harm to our patients in theater and provide prompt to give prophylactic antibiotics prior to the procedures if they are indicated.